2035. Are you in Guardian? Are you in industry or you will in hospital? Any one of you know exactly what you will be? Come, please raise up your hand. Any? Yeah. Most of us actually don't know. We don't know what is going to happen in the future. But if we do not know what is going to happen in the future, how we are going to prepare ourselves for the future? Yeah, I will talk about this later on. So, at this moment, maybe we can cross our eyes for a moment, relax ourselves, focus on our breathing, breathing in and breathing out, and we imagine our first day as a pharmacist. So what kind of pharmacist that we will like to become? Is it a clinical pharmacy, community pharmacy, in the industry, become a lecturer, a researcher? The beauty about the pharmacy is we have multiple thoughts. We can go to hospital, we also can go to the industry. But the challenge also the same. We having a difficulty in making decisions. Right? Someone said, we must go to the hospital to get the clinical knowledge, and then we go to community pharmacy. Some others say, if we want to go to community pharmacy, why we directly join Guardians? We do the PRP in the community pharmacy, and then we continue our journey. Which one is true? And some others may say, since clinical pharmacies, the hospital pharmacies, and the community pharmacies, so many, they are too crowded, there are a lot of competitions. Why don't we do something different so our life will be better? Is it? Which will be the truth? If you are having this kind of questions, you are having the difficulty in making decisions, then it's our law of MBS. We will able to help you to make decisions by giving you a good advice. Why? Why MBS? Because we have the community from the university. We have the community from the hospitals, and we also have the committee from community pharmacy. So we have all the information, and we know the pros and the cons at the different settings. Okay? So if you all have any questions, you all can ask me later on. So we say the pharmacy profession is changing. The professions that you will enter is very different compared with 20 years ago, my time. In the past, the pharmacist's role is focused on dispensing and inventory management. Today, we expanded the role to patient care, disease management, and pharmaceutical care. How about tomorrow? How the digitalizations, the AI, will influence the healthcare systems. The technology changing. The healthcare system also changing. The expectation from the patients also changing. So we have to change our role as a pharmacist together with them. So this is our challenge. We have 4 challenges for future pharmacists. The first is the recognition. Many people actually do not know what is our role. They do not know what we can contribute. That's the reason that the separations of dispensing and prescribing are not completed, divided in the private sector. The second will be expand the scope of practice. How we will be able to add more value to the patient. So we will be able to expand our role, is it in the vaccinations or other parts. The third will be the primary healthcare transformations. How we are going to prepare ourselves in preventive healthcare, or we say wellness healthcare. How we were able to play our role so that we were able to reduce the burden of hospitals. The fourth will be the career progress. How we were able to create a sustainable career pathway. How we are going to overcome the challenge. How we are going to overcome the challenge. We need to work together so that we will be able to overcome all these challenges. And MPS is play a role as a leader to lead everyone to overcome the challenge. It is not to say that MPS overcome the challenge, but MPS as a leader leading everyone of us to overcome the challenge. So, what is MPS? Anyone know? Anyone don't know? So I think everyone shall know MPS. Many people think that MPS is just an association, but I see differently. It is our home of professionals. So we have fun and we are able to support each other in this platform. MPS is the voice of the pharmacist. So we need the voice of MPS so that the MPS will protect and strengthen the professions. So we need to support MPS as well so that the voice will be unity and will be respected as well. So what MPS actually doing? So we serve as a bridge between the pharmacists, together between the policymakers, healthcare, stakeholders and parties. We engage with healthcare authorities, feedbacks on the professional issues. So we can group all MPS do in 4 pillars. One, the first will be advocacy, professional development, networking, and public health. So MPS collaborate with the government and other stakeholders to develop and influence healthcare policy that impact the pharmacy professions, ensuring pharmacists' perspectives are included in discussions. And MPS also involved in set up the professional standards. We come up with the community benchmarking guidelines. We involved in the PRP logbook, and we also present the interests of pharmacists at various forums. We ensure that the voice of pharmacy professions is heard in national healthcare matters. The world's changed, the healthcare system changed, and we know that every year we have new medications, we have new technology, we have new treatments. So it is very important for our pharmacists to continue learning and continue professional development. So MPS come out with a lot of education activities like conference, health talk, and we also launched this SIG, so-called Special Interest Group. The objective of this group actually is to train our pharmacists to become specialists. So in the future, we will have pharmacists specialized in renal, we have pharmacists specialized in geriatrics, we have the pharmacists specialized in diabetes, we have the pharmacists specialized on respiratory, oncologists, and others. So this is our effort. In future, we are not general pharmacists. We can become a specialist pharmacist. I always share with my juniors, going to university is not only getting a degree. There are some other aspects that is very important, such as to get a life partner. How many of you get your life partner in a university? Yeah. Second, we must get a seafood in our life. How many of you get your seafood? The third is we were able to build a brotherhood relationship in our university times. As we know, the caring founders is our senior, right? Anyone? Do you know? They already have their business plan during the university times. If until today you still not complete these 4 missions, the degree, life partner, seafood, and brotherhood relationship, then you must active in MPS. Why? Because we provide many platforms for you. And many of these friendship, we say opportunity, is come from people. Yeah. So you can see, in Penang, we have a very active pharmacy community. We build relationships through this pickleball. Okay? We organize symposiums, and we also have professional gathering as well. And we also active in doing the collaboration together with NGO like Hopes and Lion Club. We doing campaign of this healthcare screening to the public. So we say, a lot of people ask, what MPS can do for you? I have to say, MPS will make your life more colorful and meaningful. What MPS can do for you is from the knowledge until financial. What you need to do is just ask MPS to do for you, to help you. Some of the students may think that we join the MPS after graduate. It is good, but it is better that we join earlier, because the earlier we join, the more benefits we will able to get. So, do you know my PSA? Yes. Yeah. So you all should join IDSA today and then to become part of the MPS. So again, what kind of pharmacists will succeed in the future? The pharmacist must have three things. So-called KSA. K is knowledge, S is skill, and A is actions. We only having the knowledge is not sufficient. We shall have the skill as well. The clinical skill, the communication skill, the leadership skill, and other skill as well. So we shall able to put the knowledge into the actions. So if we able to do so, then we all will become a very good pharmacist and have a very good future. So, as a conclusion, MPS is not just an association. It is our home of professions, and I would like to encourage you all to join MPS. You can always contact us with our email and WhatsApp us through this number. Yes? Any question asked? I have completed my sharing. Yeah. Chee is our deputy chairman with the name.
Hi guys, sorry, I take this opportunity since we have another 5 more minutes for MPS. I'd like to take this opportunity to do a little bit of marketing because as the membership drive person in charge, it is very important for me. Okay, just now we spoken about the join my PSA first. Yes, it's important, but not that important. Come join Penang MPS. Okay, we are open for students as well. Alright, that's very important. Any of you seen me before? Because sorry a bit, because I have been Rabun a bit with not because of Parkinson's or but simply because I really cannot recognize the face. Okay, so just now actually we have to go through a little bit. So what we can help you with? Okay, the first one and the second. The first one is very important. I keep on telling I think the last one I informed was Ivan. I keep on saying that hey, for your community outreach program, you can come to us. Okay, we have pre-planned one already. We found the space, we found the resources. We just need people to fill in, to come in and do the blood test together with us. I think for last year we did 12 sessions, spanning from July until December of 2025. Okay, and then what you will be getting? First of all, you get direct mentoring on counseling. Okay, what you do when you are doing a primary screening as a pharmacist, what you can consult. Okay, when people ask you what kind of question, what is the safe answer that you should be answering as a pharmacist? That is very important because we don't want to get ourselves into trouble. Okay, we want the best for our clients, our patients, but also we don't want to get ourselves into trouble with giving a wrong answer. That's very important. Okay, and then the second one, alright, the second one actually, this lady is your senior. I think she graduated last year, and then this is actually a practicing pharmacist. So this is what happened during during a screening session with MPS. You get a direct one-to-one mentorship, okay, from a proper pharmacist to teach you how to do counseling, to how to read the reports, to how to see the supplements that the people is going to bring it to you. Okay, so please contact me if let's say for whoever going to host for the community outreach program for next year. Okay, the phone number is the one on the screen just now. Okay, and then actually to add on a little bit, okay, let me to be proud a little bit, is actually the second one. Okay, this is actually, the story behind this photo is actually the first prescription being endorsed during the My Ubat in Community program. Okay, so Penang is the first and I guess still the only one that having this program in Malaysia. What this program means is actually every of us is having a little bit of our members in family that is getting their medication refilled in government setting, right? So government setting is always very packed. It's always not to blame just because of their volume is very big. So it is very busy and it's sometimes can be very time consuming to get your medication refilled in a government setting. So actually for this My Ubat in community, is actually you can see the doctor from government setting, get a prescription, and get a medication delivered to any nearby community pharmacy. Right? So which make it like, okay, I am staying in Bali Pulau, I need to go over to Hospital Pulau Pinang to see a doctor because there's only the specialist only available there. Okay, so during the medication refill, I don't need to purposely go until HPP to get my medication refill. It is 40 minutes to 1 hour of drive. Right? So I can just go over to any nearby pharmacy. Sorry, there is no near me. Sorry. So you can go over to the nearby one. In Bali Pulau, there is pharmacy Bali Pulau, there is Alpro, there is Georgetown. Right? So you can just go over to there, tell them that, okay, for next time, I want to get my medication refilled at the pharmacy. So instead of you travel all the way from Bali Pulau to HPP for 1 hour to get your medication, you can just go over, just walk over, just 5 to 10 minutes to get your medication refilled. So we are very proud that this happened in Penang. Okay, we fight for it for a long time. Okay, so that's a very important cornerstone for us for the past 5 years. All right. So with that, let me just show again. This is my phone number. Directly reach me. Okay. If you are interested, we are still recruiting for our assistance for our community outreach program for the end of the year, and also we are having another quite excited program upcoming. It's called Accelerate. Alright, so which is you are going to get a personal mentor as well. You are going to have a one-to-one session with someone. And just now we said you have a sifu in your life. Alright, so you are going to be assigned someone and give you some insights for the fields that you are about to enter. Okay? With that, thank you.